welcome back to It's Not Just Cramps. As you know, I've made this channel to talk about my experience with endometriosis. I'm not a doctor and I'm just here to vent when I need to vent, to talk, and if there is anybody that I can help, I'm more than happy to do so, more than happy to answer any question. And that's because when I started to get my diagnosis, I was looking for people that went through the same and trying to, that's because I was trying to look for people that went through the same and trying to understand, you know, what to expect and how many stages are there and everything. So, where were we? I think we spoke about, it's been a rough one. So I had a mental breakdown because I've been called for surgery at the beginning of May. Was the wrong surgery, and that was kind of my fault because I got lost for follow-up after my laparoscopy, and that meant that nobody was doing anything for me. Nobody was helping me. Nobody was drawing a plan. Nothing was on place. So I went through different systems to get them to hear me, you know, complaints and the PAL system of the hospital. And they've listened, but obviously, because at that point it was just me putting pressure on them. I think the administrative part tried to rush it without really looking much into what I needed for my surgery. Because in fact, during my last consult, I got told that I would have needed my op done in a different hospital, more equipped. But then they called me into my hospital to get my op there. So it was just like a lot of up and downs emotionally. And then after all of that has been so many doctor appointments I had in the last month. One just today. But we are on the point where I know the plan. I know what they're going to do. I know who is going to be my surgeons. I know the best and the worst outcome. And there has been all this massive, huge thing with me and the contraceptives because I think I've made a video, but I've never posted it. It was about my contraceptive. I've been on the combined pill for many, many years. During COVID time, I stopped everything and then I went on the progesterone only. But that has given me so many side effects to the point where I'm not allowed to have the combined pill now. So that has annoyed me quite a bit. And it ended up with me giving up on the idea of taking any contraceptive. And I was just like, you know what, I'll get to my worst and hopefully whenever my surgery is going to be, I'll get sorted. Because usually once you stop the pill, the pains don't come on the same level. Like, at least for me, it was a gradual worsening kind of situation. So the first month will be bad. The second month will be a little bit worse, and it kind of like builds up over a certain amount of time. In fact, the first time it took me nearly 2 years to crash completely. But they decided that I needed, we agreed that I needed to go on an induced menopause. That has got me very emotional. You know, the feeling a bit of, you know, I failed as a woman, and I don't know why. It's nothing similar, but it gives me a bit the ideas. I don't have a full hysterectomy, like everything is still there, but knowing that it's all off, I don't know, it just makes me wonder. I know everything's going to go back to normal once I stop it because I'm young. But it's just my brain that goes with, what if? And I'm not here to give you any worries. I mean, the science is strong. I'm just a bit anxious as a person. But yeah, because on my first laparoscopy, when they tried to move stuff around, it was a diagnostic laparoscopy, and it was a laparoscopy to remove an ovarian cyst. But they couldn't do it for the simple fact that there was too many adhesions and I was bleeding too much during the operation. So they thought that being on the injection should shrink a bit the lesions. They don't disappear, they just shrink, and they stop, or they reduce the blood supply to them. Again, I'm not a doctor, so do research. But yeah, I feel like I need to clear some stuff up, because all I've known till my multidisciplinary meeting was very broad, very unclear, because I've been lost for follow-up. My GP have tried to explain the surgical notes to me, but again, they're not surgeons, so they don't really know what half of that means, and they're not the person that's operated on me, so that was another problem. And then the nurse has tried to explain that to me, but again, she's not the surgeon. So some of them have downplayed it. Some of them have tried to use simple words for me to understand. But then that has created confusion in me, because I've done my research and I couldn't find, correlation. Certain things I've just dreamed of. Because obviously when you come out of surgery, sometimes you have a quick chat with the surgeons, and I was way too high. I remember her telling me that I had endometriosis, that it was everywhere, that they've done nothing because it was too risky without other surgeons present. But in my head, I remember that she said that it was involved in my spine, but apparently during the consultation, that has been cancelled out. So apparently they couldn't see my spine, so therefore she couldn't say if it was or it wasn't, but she didn't say that to me. So I would like to clear that up. But yeah, now we are at the point where I have all of my surgical notes, all of my this. Yeah, if I cover here and I cover here. So I got all of my information. I might cut that through because I don't know if I've showed things that I was not supposed to. But yeah, so that has been a bit of a pain. The meeting with the multidisciplinary team has been fantastic. Both surgeons, I had the bowel surgeon present and the endometriosis specialist, the gynecologist. Both tried to explain to me the situation, and they've done so in a graceful manner, trying to make me understand what I was choosing, what that will imply, and everything. So the appointment has gone on with the first part being a discussion onto what they found, what they really found, how bad it is, what does that mean for me, and everything. And then the second part was what is the plan that they will take on the next surgery. So they explained it to me as my fallopian tubes and my ovaries are kind of like hugging the bowel. And their main concern is the two parts where the bowel is attached to the system. So the bowel is attached where the ovary are, where the cyst has grown. So that is a big block, all one, where you got ovaries, teratoma and bowel all joined together. And then the second part that we discussed was the part behind the uterus, going towards the axis, so the bottom part of the bowel. I have been given 2 options for my operation. My first option was to go in and remove all the endometriosis that they could see. And once that was done, that was it. But that was coming with a lot of risks. So in my case was removal, risk of damaging the uterus and ending up with a hysterectomy, and the risk of perforating the bottom part of the bowel, and that will have mean a temporary or a permanent colonostomy bag. And they've explained it as trying to peel a bad orange. So trying to separate those two could end up with rupturing one of them or both of them. So they don't want to risk that, especially because so basically the outcome of the decision was either removing part of the endometriosis or remove part of the endometriosis, leave some behind. That could mean that they will leave behind the part that's causing me pain, the lower back pain, the digestive pain and all of that. Or they could remove all the endometriosis, but obviously that could mean fertility issues because I might end up without a uterus. Whew. So that was a big choice to make a bit on the spot, but I want to have kids. I want to have many of them. I hope to get there one day. So I prefer, as of now, to deal with the pain for the hope that maybe one day I can say I'm pregnant. So that is the way we've decided to go with. But there is still some risks because the upper part of the bowel that is touching the ovaries, that is going to be where more of the surgery is going to be concentrated. That could be damaged, but we have agreed to, worst come to worst, they will do let me find the word, a bowel resection, and I've agreed to that. Hopefully they won't need to, but if it happens, yes to that area, because that is impossible with the pain. And if it comes that I need a colonostomy bag caused by that, I can live with it because my uterus is still intact. So yeah, during my surgery, I got here my notes in front of me. They're gonna remove cysts from both ovaries. They're gonna remove or try to remove all adhesions. Uterolysis, don't know that. Something to do with the uterus, I guess. And then I got a cystoscopy plus or minus uteric stenting, bowel shaving, bowel resection, and they're gonna do a dye test to check for my fallopian tubes to make sure that, you know, if one day I get pregnant, that the egg can actually travel through the fallopian tube. So that is the plan. I have a plan now. To get my next up, I need an injection of, forgot the name again. So I got a piece of paper with me now. There is a new letter that I just got this morning. So to have the surgery, I'm gonna need an injection of GnRH analogs. and I think those are called decapeptyl something. But basically, it's a medication that put you in a menopause temporary state. I've just got my injection yesterday. It was disgusting. I feel like I'm a grown up. I'm 28 years old and I hate a needle. But you know, hopefully it will be worth it. And it was painful. More than any other vaccine or anything. It's nothing like crazy, but I was singing the what is it called? You know, when there is a state and I have the song for that state, L'inno. I just started to sing the Italian song. So that was kind of funny. It was my way to hide my screaming. I don't know why I thought about that. I just started singing really loudly. And next door there was a woman giving birth and I was feeling so silly. But yeah, it only lasted for a minute and then it was done. And I had a bit of a sore bum all of yesterday and today, but nothing major. I'm just a bit of a drama queen. I'm a bit traumatic and traumatized by all of this. So don't get too worried. If you have to get the menopause injection, it literally lasts 1 minute. The nurse was absolutely amazing. She exactly explained to me what to expect. She gave me all the information I needed. She gave me the phone number to call if I was worried about side effects, if I needed anything else. And I was just like a baby crying because I felt, I don't know, a bit like, I don't know. I don't want to say that I've been castrated, but it kind of like feel in my head. And I know it's not the same thing, but it feels a bit like that. It's not a good feeling. But I know it's all in my head, so it's all good. We're good. I finally have a plan. So now they told me that I'm gonna have to be on this medication for at least 3 months. That is how long it takes for the drug to work in your body. Not to work, but to make sure that my system has been turned off. So within 3 months' time, I should get my surgery date, finally. And then there's gonna be my op, and I'm really hoping to get some kind of relief. I know I've opted for the option where I might stay with my pains, but I'll be happy with anything. At this point, I'm happy with anything. So is the injection. The injection is supposed to help with pains as well. They basically, if you do get the injection, it works in a bit of a weird way. So it will give you a rush of hormones and that will cause a flare-up. It might not cause a full flare-up, but there is a risk for you to having a bad endometriosis flare-up. After that flare-up, the door for hormones gets shut and everything goes to sleep. No more ovulation pain, no more cycles, no more pains. So that is what I'm hoping for, and the reason why I'm gonna power through the next couple of weeks. I might keep you updated on how that goes, but as of now, I'm doing fine. I'm 1 day post. Felt fine, no headache, no dizziness, no stomach ache. I mean, the average is under my usual headaches, my usual stomach ache, but nothing has changed after the injection. Well, except the sore bum and a good mental breakdown yesterday. But again, that's me. So at this point is all about being patient and waiting. Because I'm a bit of a pain, I like questioning everything. I like stressing people out and I want to be heard. And apparently many months ago, I requested an MRI. Because then I question, you know I've struggled with walking for 2 years. You know I can't do much. You know I cannot move alone by myself. You know I have problem with my shoulder, my right arm that got completely numb and useless sometimes. And no one thought about looking onto that? Like, no one wanted to do an x-ray, an MRI, just to make sure that everything was fine? So that got me a bit worried. And I know my pain is all caused by endometriosis, but my questions are, where exactly does it grow? Does it grow on pelvic wall? Yeah, it does. Does it grow on my uterus? Yes, it does. Does it grow on my nerves though? Because my legs go numb. I can't walk. I have a walking stick. So what's that? Is it just like normal? In fact, today I've seen a physiotherapist. So going back to that, I've been waiting for an MRI on my spine for many months. And one of the doctors at the GP practice I go, that I really love her, but she thought that my pain was not normal pain. So she gave me an MRI for my brain. Because on top of my leg pain and shoulder pain, I had migraines, and they were caused by the progesterone-only pill that I've stopped, and my migraines and light sensitivity gone. But she just wanted to make sure that, if there is another issue, not to blame everything onto endo, and to check with an MRI scan of my head. So when the opportunity showed up, I was like, yes, can we please add a spinal MRI? I want to make sure that my nerves are all fine. Because if you say that they're all fine, I'm happy. I know that my pain on my legs is all referred pain, is all referred weakness, and therefore my leg is fine on itself. But if there is a damage, I would like to know and to have a plan for it. So she agreed to give me an MRI for my spine, and I finally got my appointment last week. Got to the hospital, I did my brain MRI, and then I've asked about my spinal one. And apparently that has been rejected many months ago. Because, just if you're in the UK and you don't know, this could happen to you. Apparently, your GP cannot refer you for a spinal MRI if you've not been seen by a physiotherapist. In all of this, I've never been seen by a physiotherapist. They gave me high drugs, they gave me everything, but I've never been made aware that I needed to see a physiotherapist, because I'm a bit ignorant. So in my head, I'll go to the physio if I'm doing rehabilitation exercises. I won't go to the physio if I have pain. If I have pain, I'll go to a doctor. But I'm stupid, and I've learned that. So if you have pain moving around, shoulder pain, arm pain, leg pain, it doesn't hurt. If you can manage to get an appointment with a physiotherapist, go see him. They're great guys. They might be able to help. So I had my chat with him today, and I explained him all of my symptoms. He looked at my file. He knew about the endometriosis, the pelvic pain, and everything. And we did some exercises. Not exercises. We did like what is it called? Like a checkup, a body checkup. It just like tested my reflex and touch like my spine to check where it was hurting, and push here, pull here, up there. And it was like trying to see how my leg moved and how my arms moved, and if I had like a stronger part or a weaker part. And the outcome was that my left side, where my ovary is, it's weaker. The reflexes are good, so that's a good sign. Everything else is good. It's just a weaker side of the body, and the calf, the muscle of the leg between the knee and the Achilles part. So that big muscle on the back, it's a lot smaller compared to the other side that has been overdoing. So did my spine. So because I walk a bit funny, when I managed to walk, I built muscle where I was not supposed to, and parts where I need muscles are weaker, and so on. But in his opinion, I was kind of fine. He just thought that probably all the pressure caused by the endometriosis might have been causing some problems with the sciatic nerve. But again, he didn't believe that I could have nerve involvement. So I was like, yeah, that's okay. You know, if you think so and the hospital thinks so, I'm happy with that. I mean, guys, you are the one with the doctorate. I'm just a person. And then, you know, I was kind of happy because that meant that maybe if one day I'll get all of my endometriosis removed, maybe I can walk normal again and be normal again. But I got home and I got a phone call and it was like, hi, yeah, I went through in a better way on your file, and I think it's better for you to go and see not a real specialist, but like a hospital physiotherapist, and then can decide if you need an MRI. I think that is the safest route to take in your case. I don't think there is any nerve involvement, but if there is, you know, and we are aware of it, we can do something about it. But everything else on you is fine. Your hip is fine. Your knees are fine. So like, don't you worry. You're all good to go. But yeah, and then he sent me like a couple of links of YouTube exercises to keep the balance in muscle mass. So this is where I stand now. I feel like this has been way too long, but we have a plan, and I like that.